The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Welcome to Aging Horizons and happy holidays. This week we'll be addressing alternative pain management techniques and therapies from three different individuals that is an alternative to taking traditional medicines. We'll be talking about what they are, how they've helped people, and how they might be able to help you. It's a lot of great information, so stay tuned. We'll be back in just a moment.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, but my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
In 20 years at an electric utility, I've seen the hardships many of our neighbors face with high winter heating bills.
Ross Holter, Flathead Electric Co-op.
That's why I donate to Energy Share of Montana. I just hate the thought of senior citizens, and young kids especially, being cold in the winter. Donate to Energy Share. Help your neighbor stay warm.
To donate, call 888-779-7589 or go to EnergyShareMT.com. Energy Share, you can help your neighbor stay warm.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Hi folks, welcome to Aging Horizons, which is brought to you by the Department of Public Health and Human Services. I'm your host, Brian Lamore, and as I mentioned in the opening, we'll be talking about alternative therapies and practices to help address pain in individuals. Joining us today is Dr. Kaylee Burns. She's a naturopathic physician down here in Billings. And Kaylee, let's start at the top. What are CBDs and how do they help an individual?
Yeah, so CBD is actually a component of cannabis, also known as marijuana. CBD is the non-psychoactive component of the plant. It's very good for addressing the inflammatory component to pain, which is why patients seek it out in a variety of different forms.
Yeah, and so, but is CBDs marijuana as we think of it that's been illegal, or is it a part of it? It's complemented?
Yeah, so CBD is a part of what we think of as recreational or medical marijuana. Medical or recreational marijuana also has THC, which is traditionally known as the psychoactive component. And both of them are involved in helping with pain.
Oh, so you need both of them to address pain issues.
Yes.
Now, you know, sometimes we have pain, we take an aspirin or two, but we're talking about longer lasting, more enduring pain, right?
Yes, absolutely. The chronic, more severe, those who have maybe relied on a variety of medications for their pain.
Now, do they take the CBDs while still taking their medications?
They can, however, there are interactions with things such as sedative medications, so we want to avoid those, whereas opioid medications do not interact, and they can actually be used to help with some of the withdrawal. We can use cannabis or CBD to help in those regimens.
Well, does the CBD complement opioids, or is it used in reducing the addiction?
Used to reduce addiction, used to reduce withdrawal. It's part of the push to help reducing mortality from opioids.
Now, you know, when we talk about aspirin, there's just one type of aspirin, but with CBDs, there's a lot of variance, right?
There is, yes. That comes down to the strain, the dose, the route of administration. There's a lot of variety when we get to that.
And how does one find out which one works best for them?
It's going to be a wide range there,
Yes.
whether it's being used for pain, anxiety, other various routes. PTSD is a large one. That's going to determine whether we need to do a faster acting, so a sublingual. Would be good for that because we're bypassing the digestive tract, so we're going to have more absorbed. It's going to last for a longer period of time. If we're looking at something more in terms of a mood support, we might have a different ratio between THC and CBD in the cannabis plant. So it's going to kind of be very individualized in terms of strain and dose and all of that.
And do you know, as a doctor, what type to prescribe them, or is it kind of a trial and error on the patient's part?
When it comes to CBD, we have a bit more knowledge there because we're not having the THC component to it. That we start lower and we titrate up with our doses. In terms of the medical card or medical cannabis, we usually use certified practitioners for that. Those who are at the dispensaries have a lot of knowledge in terms of how to help patients with that concern.
Great. Well, now with CBDs, is there I guess there's a strength that is listed on them, and is it uniform, or does it really diverse?
Yeah, so depending on the quality of the product, there should be a strength listed. So the products that we're going to be using in our office, they're going to have a milligram dosage, which is how we titrate up with that. I guess that's the simplest answer to that.
Well, now, for the people who are watching, they're in pain, they might think, well, it might not apply to my pain. Is it pretty universal, or is it specific ones that...
Yeah, I think we're still learning a lot there. However, given the receptors that CBD is going to bind to, it can be neuropathic pain, somatic pain, visceral pain, hypersensitivity, kind of a variety there in terms of that.
Okay. And is it taken internally only, or do you put it on your skin?
They do have topical uses. So I have a lot of patients who use like a balm that's really great for sore muscles, for skin rashes, all kinds of different things.
Well, it sounds like it's almost a miracle drug. But there's a lot of research going on with it too. I attended your presentation at the governor's conference here, and I was impressed with what's going on.
Yeah.
And it's really being looked into thoroughly,
Absolutely.
isn't it?
Yes.
And what are some of the things they're coming up with?
Yeah, so they're looking at chronic use in terms of combining with opioid prescribing. There's some really neat studies in terms of these little things called troches, so that you dissolve it in your mouth. It's a sublingual, and that being able to actually, they had a surprising 84% were able to reduce or completely eliminate their use of opioids.
Oh, that is tremendous, particularly now that they're having major problems with it. But could it replace an opioid in an individual to address the pain that the opioid did?
Definitely possible.
It's possible. You have to try it out and see, huh?
Yes.
That's great. Well, now, we find CBDs in everything from gas stations to clinics. What can you say about, is the gas station CBD is just as good as what you might have in your office?
Not likely.
Yeah, not likely.
So we're always looking at quality control. We look for a certificate of analysis, which is going to tell us more about the cannabinoid content. If there's any pesticide risk or contamination or anything like that, we're always looking to find the cleanest product we can. But also, the product is what it says it is what we're looking for. So that's a big difference between that variety of products.
Well, now, for an individual who's thinking of using CBDs, and you're saying you get so much more information, how would one access that? Because usually it's not in the little bottle at the gas station.
So the companies are required to show their certificate of analysis. So usually with their website or things like that, they should have that data for us so we know how clean and pure it is.
Okay. Do you know where an individual might be able to go to get basic information about this, or ask the Google?
Google's going to have a lot of different answers. But it's always good to talk to maybe your physician or someone. If at the health food store, they're going to have people who have a little bit more knowledge about it. And then the dispensaries, they have the most knowledge in terms of the strain and the quality of the product and things like that. They have a lot of knowledge.
Okay, well, that's fascinating. Well, Dr. Burns, we're unfortunately drawn to a quick close on the show. And for our viewers, you might want to look into this. You might want to talk with your physician, your naturopathic physician, and start addressing those issues with CBDs and see how it works. Stay tuned, we'll be right back.
I was the last guy you'd expect to get diabetes. I was a competitive runner and I always took care of myself. So when I was diagnosed, it kind of threw me. But it's really encouraging to know I'm not alone with it. There are a lot of other people going through the same things as I am. It takes some effort. You have to keep after it. Exercise, meds, and diet are the key. But there are a lot of folks who want me to succeed. Diabetes is not the end of the world. With effort and attitude, you can have a normal life.
Are you looking for a helping hand through the maze of human services, or for information on government programs and benefits that you may qualify for? The Information and Assistance Program provides information on all programs that meet our aging population's basic needs and programs that enhance their lives as well as the lives of their families or caregivers. If you have questions about Medicaid, Medicare, or other services and programs, please call 1-800-551-3191.
Every generation produces heroes, men and women who step forward to defend our country in time of need, no matter the personal cost to themselves. And though we can never fully repay them, we can make sure they have access to low-cost, long-term care when they need it. That's what Montana's Veterans Homes are all about. If you've got a hero in need in your family, call us. We can help.
I take care of my wife at home. When I found out training was available, I said, sign me up. It's made a huge difference.
When my husband was injured at work, it was life-altering. The classes taught me that it's okay to grieve, to ask for help, and to better cope as a caregiver.
My dad lives 4 hours away, and the Powerful Tools classes taught me that it's okay to ask for help. I highly recommend them.
To find out about this course for caregivers, go to powerfultoolsforcaregivers.org.
It's amazing the difference a little training can make.
Hi folks, welcome back to Aging Horizons. We're continuing our discussion about alternative therapies for pain release. Joining us is Sharon Foreman. You're a movement educator. And I guess let's start at the top. Let's define what movement is.
Movement is anything that gets you out of stillness.
Yeah.
So it could be walking, it could be dancing, it could be stretching, it could be just bouncing. So anything that gets you out of stillness is what I define as movement.
That's great. And you're an educator, so you teach all that. What all do you teach to address that issue?
Yes, I teach somatic movement classes, which are free-form, flowing, very specific, but very free-form movements. So they're guided, but moving from the inside out. Mm-hmm. I am a yoga instructor for 40-some years. I also am certified in restorative yoga, and I'm also a licensed massage therapist.
Massage therapist, that's great. Yes. Well, now, when a client comes to you, do they have problems with movement, or do people just not move at all, or what problems do they come presenting to you?
You know, I'm working more and more with an aging population, so people come to my classes that are feeling a little bit stiff, a little bit tighter. Maybe they have an injury or a trauma to their system. They want to learn how to breathe better. People come to me because they want to work with their balance, to become more fluid and flexible in their bodies, to build a little bit of strength. So there's a myriad of people that come to me with different situations.
Different issues. And you, in your presentation, you mentioned you worked with, was it Parkinson's people?
Yes, I am certified, or I'm trained in the Dance for Parkinson's program through the Mark Morris Dance Group in Brooklyn, New York.
Great. And how does that help the individuals with movement? I mean, it doesn't seem like it's a medical model.
Well, more and more neurologists and the medical community is becoming more aware of movement with people with Parkinson's or movement disorders. So the Parkinson's class is wonderful. We're mostly done in chairs, although we do get up and stand, and we actually move across the room. So a lot of it has to do with focusing. You know, when someone with Parkinson's starts to focus, their attention shifts, and it's been beautiful because in the very beginning, or if someone has his first time coming to class, they're a little bit uncomfortable, a little shaky, and within a short time, and certainly by the end of the class, there's fluidity, there's ease of movement, there's certainly a lot of joy. It's an amazing group of people.
And it helps their life. Well, now, I hate to say it, I've gotten a group of seniors, and stiffness comes along. So you don't have to be going in for therapy, but every day, I guess, practice, I guess.
Well, every day we're aging.
Yes.
Every one of us, from the day we're born till whenever, we are aging, and our bodies are changing and shifting, and just life gets in the way, and so there might be an injury, or there might have been some sort of a trauma or a congenital something. So movement, I think, I believe really that connecting with your body,
yes,
with your breath, with, I think about it as like just exhaling, dropping into your body, slowing down,
yes,
unwinding is magical to your body.
And we need to almost consciously do that, because otherwise we don't. But now you had us do an exercise during the presentation. Could you do that for us now? Because our viewers can do that, can't they?
Yeah, well, what I find is, that our coordination sometimes changes. So I was in class one day. It was one of my chair yoga classes at the senior center, and it came out of the clear blue to, someone mentioned the itsy bitsy spider.
Yes.
So we started doing that. So what we do is we take our thumb on one hand and the first finger on the other hand, and start to walk up. And of course we have to sing the song, because that makes it fun. So the itsy bitsy spider goes up the water spout, down came the rain. So you're wiggling your fingers, you're getting movement in your fingers, and wipes the out. Up comes the sun and dries up all the rain, and then the itsy bitsy spider, I have lost myself here, comes down up the spout again. So one, you're getting coordination. It certainly is fun. You get to sing. You get to kind of reconnect with childhood a little bit. So there's so many things in this one simple little exercise.
And you just focus on it, and it's that simple, isn't it? I mean, I guess we have to be children again.
Well, I think we're all just big babies. We just grew up, right?
Yes, we did. So, but you are also a yoga instructor, and you've done that for a long time, too.
Long time. I've been teaching since 1984. I started yoga in 1976.
Now, can seniors start yoga, or is that something a young person
Absolutely.
has to do?
I do a lot of chair classes. Anyone can move at any stage in their life, no matter the shape, size, man, woman, child, it doesn't matter. We can all move, and you can breathe. The myth is that you have to be flexible already, or I have to be a pretzel, or I can't do that. You absolutely can. In my classes, we work with props, we work with chairs or blocks or belts to assist and bring intelligence to the body. So if you're willing, if your mind, you're willing and having a curiosity, you can absolutely do yoga, you can dance, you can move, and feel better, you have more balance, you can breathe better, you can stand taller.
Yes, and at any age you're saying you can get into this and enjoy it.
Absolutely.
To just start. What word of encouragement could you tell people to start doing it?
Oh, well, start with an exhale. And feel your body just drop in, kind of like settling. I imagine sand in a glass of water, and it settles, and you find ease. So I think one of the what I say to all my classes is, how can we find a little bit more ease in our body?
A little bit more ease.
Just you feel a little bit better.
More relaxing, and that helps with possible pain that you might
Absolutely.
have. Mobility issues.
Yes.
And I imagine communication down the road,
Absolutely.
too.
And joy.
Joy.
Pure joy.
Well, thank you for joining us, and we'll be right back with another segment in just a moment.
This is a secure federal facility. Do you have your Montana Real IDs?
ID. I am Captain Lewis, and this is Captain Clark.
I'm sorry, I can't let you in.
Can't go into a federal facility, can't fly. Let's go back to the river.
Yes, we'll float home. Let me check the Google. What's a dam?
Discover more at mtrealid.gov.
Montana Real ID. It's the real me.
It was a beautiful day. There was about 2 square feet of ice near the door, which I slid on and fell, cracking one rib. And it became somewhat frightening for me to walk outside, particularly in the winter. The Stepping On program came as kind of a surprise to me. I didn't know about it. I've learned the importance of proper balance. I think anybody who has fallen or is afraid of falling would benefit from this program.
3,000-pound walrus? Good insulation. 10-pound Sphinx cat? Bad insulation. Puffed up cardinal? Good insulation. Naked mole rat? Oh, bad insulation. If your home's insulation isn't all that it could be, the Low-Income Energy Assistance Program may be able to help. Call today. You just might be eligible for weatherization assistance, and that could make your nest a little cozier.
It's been 27 years. I never thought I'd still be smoking, but here I am, COPD and all. I'm about to have a granddaughter. There's so much to show her, but I'm scared I won't be able to keep up like I used to. I kind of gave up on myself on quitting. But it's different now. I want to be here for her and for my daughter.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about alternative pain management. One of them is cognitive behavior therapy, and we have a therapist in that field. We have Janet Schroeder. And Janet, you're a licensed clinical professional counselor down here in Billings, and we're talking about cognitive behavior. Let's start at the top. What's cognitive behavior?
Cognitive behavior therapy was first developed by Dr. Aaron Beck. He's 94 years old and he works at the University of Pennsylvania still. His daughter, Dr. Judith Beck, she runs the Beck Institute on Cognitive Behavior Therapy. So cognitive behavior therapy is really just like what it sounds. Cognitive meaning what you think, behavior, what your actions are. So that's what I work with people who want to get CBT training for chronic pain. So I work with we work together collaboratively to work on their thoughts, their cognitions, and then try to change their behavior.
Change their behavior. And is this an acquired issue that people have, and how do they acquire it? I guess it's with pain, so you know where it's from, but maybe what is the reaction to the individual that is wrong that you help with?
Well, first of all, typically when someone comes that has been referred for CBT for chronic pain, they have had some sort of an accident, and so I go through what happened, then we talk about the brain, as far as the brain in pain, and we look at there's always different ways to look at things, and it's called automatic thoughts. We have automatic thoughts that run through our head throughout the day. An automatic thought is something like, gee, that light is bright, or someone walking by who's maybe talking too loudly, or that you go outside and you see that today is the leaves are changing, and so your thought is, oh, fall is here.
Yes.
So those are the thoughts that I'm not concerned about. But the thoughts that are concerning are the thoughts that are, I can't stand my pain. Pain is ruining my life. So those are what I try to target. And those automatic thoughts also have a reaction, emotional, biological, and physiological. So the biological part is what we are feeling, and the increase in blood pressure or feeling nervous or sweating. The emotional part might be that it would be like crying or just feeling like you have to go to bed. So those are some of the negative things that happen from these negative automatic thoughts.
Yeah.
So these automatic thoughts are kind of like a garden, the negative ones. When you look at a garden, you have, vegetables, fruits, but you also have weeds.
Yes.
And so I try to help people that have these negative automatic thoughts. We try to pull those weeds and keep the flowers, vegetables, because those are not what's bothering them. It's the negative automatic thoughts.
Yeah. Well, as you're describing that, the thought that came to my mind is what we think our body does. So
Right.
we try to get the proper thoughts, I guess. Not proper, but, therapeutic thoughts going to them.
Yes.
Yeah.
And it's more than just the power of positive thinking, but it definitely is in that realm of treatment, is that I'm trying to also change behavior by trying to get them to think more positively in their life. And then I also we do lots of different activities. I have an 11-week program called CBT for chronic pain, and in those 11 weeks we do look at pain and stress are related, and stressful situations can cause pain. So a stressful situation might be something like you have an argument with your spouse, and then we have all these thoughts in our head like, gosh, I wish I wouldn't have said that, or I wish I would have said this. And so those thoughts that are negatively based, that's where I try to work in those thoughts. And then some of the other things I do is we do coping self-statements. So I give them 3x5 index cards, and they write some coping self-statements like, I am not my pain, or I'm trying to help me help myself. And it doesn't always have to be about pain. It could be something like, I am loved, or others trust me. And so then after we do these cards, I laminate them, and then I ask them to put them around their home. Put them on the bathroom mirror, or on the refrigerator, or on their nightstand. When they wake up or go to bed, they have this positive reinforcement.
Maybe they shouldn't watch the news anymore. Well, that sounds fascinating. So do you find that the majority of your clients are given prescriptions by a physician to go to you, or do you find people that are kind of self-referring to your services?
Either way. I have had some physicians that have referred. Claims adjusters who work at in a work comp situation, they also can refer, or someone could just call. And I take all kinds of insurances. I take Medicaid, so they come to me from just call or email me. I have a website.
So as a result of this therapy, you find people reducing their pain meds or coping better with it?
I think coping better with it is probably a better term. My role is I'm not a physician, so I don't give out medication or try to reduce medication. My goal is really to help the client to be able to deal with the pain that they're currently dealing with.
Oh, that's great. Well, for our viewers this holiday season, when you talk to your friends, maybe spouses, family, this might be a therapy that could apply to them. For Aging Horizons, I'm Brian Lamore. Thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.